And Tom, so you have spent many years as a public official, and you're an expert in many areas, but certainly including health policy and health reform. So again, given 3 minutes with the next president, which health policy issues would you say must be included on the health agenda, and for which issue is he or she apt to have bipartisan support?
Well, Victor, first of all, I think it may be the only time I can think of that I hope I get stuck in the elevator. Secondly, I think I would give Mark, Mike, Risa, and Larry's memos to the President in my first 10 seconds, just to be sure he or she was fully cognizant of the wisdom you've just heard. I agree with Mark, especially with regard to how counterintuitive it is that there is real potential for bipartisanship next year. I would list the must-pass legislation as Exhibit A. We have to pass FDA reauthorization. We have to pass CHIP next year. We have to pass the extension of the community health centers. We have a tremendous research opportunity that if we don't finish in the lame duck, and I have some doubt about whether we will, we have to address research next year. And frankly, if we don't address the individual marketplace, we're gonna really be very, very in a very troubled situation. So those are all pieces of legislation that already enjoy broad bipartisan support and proven by the votes that have already been taken. So I would start with that. Short term, we have an agenda that's already prescribed. But then I think we've got to move to long term, and the President and Mike is so right. That time goes quickly. But in the longer term, we've got to look at performance. How is it we can be spending $10,000 per capita in this country and not even rank in the top countries of the world when it comes to overall performance? We've got to address that. And the only way I think we can address it, and I'm hoping that we can convince the President of this, is to deal with infrastructure. Infrastructure when it comes to our payment system, infrastructure when it comes to the way we measure quality and value overall. Delivery and payment reform has to be at the very highest priority as we look at performance and the way we solve the problems we're facing in this country. But I'd go a little bit farther with infrastructure in the longer term. First of all, I've always maintained that we don't have a health system in this country. We have a collage of health subsystems. And those collages, that collage of subsystems are siloed. And because we're so siloed, the integration of our subsystems really have to be addressed. And the President, and only the President, is capable, it seems to me, of helping to create the new environment within which we can tear down those silos and create more integration within the subsystems that currently exist. The second part of the infrastructure that I think badly needs addressing is our healthcare pyramid. I've always believed that healthcare in any society looks like a pyramid, where at the base of the pyramid we have wellness, primary care, and all the social services that make for a good, healthy life. As you go up the pyramid, we become more and more sophisticated and technological, where at the very top of the pyramid we have heart transplants and MRIs and all of the things that our sophisticated technology has brought in the last couple of decades. Every society starts at the base of their pyramid and they work their way up until the money runs out. In the United States, we start at the top of our pyramid, we work our way down until the money runs out. We need a recognition of the importance of those social services integrated with primary care if we're going to get this job done. And finally, and just as the door is opening, I would say, we've got to keep our eye on the goal. And what is our goal? I think there's Republican and Democratic support for the goal simply articulated. We want to build a high-performance, high-value healthcare marketplace with better access, better quality, and lower cost. Let's get it done.
Thank you. A round of applause for everyone.